Good day and welcome to Dr. Anyoha's podcast. Today's topic is umbilical hernia over the belly button area. Umbilical hernias, those soft bulges at a baby's belly button, are one of the most common things I see in newborns and young children. I probably see a new case every month. This podcast was inspired by a healthy, energetic 3-month-old whose mother finally asked, "Doctor, what exactly is this thing on my baby's belly?" I was happy to explain why babies get umbilical hernias. The story actually starts in the womb. When babies are developing early in pregnancy, around 2 to 3 months, their intestines briefly sit outside the abdomen as the body grows and reorganizes. As development continues, the intestines move back inside behind the abdominal muscles and the umbilical opening closes. An umbilical hernia happens when a small gap is left in those muscles at birth. A bit of intestine can slip through that gap and sit right under the skin, causing the familiar soft bulge. The good news, babies are still growing after birth, and that tiny opening usually closes on its own over time. Many clinicians see this as simply a delay in muscle development, not a disease. Most hernias close by age 1 or 2. We usually don't consider surgery unless a child is around 4 years old and the opening hasn't improved. What umbilical hernias look like? Think of the hernia as a small, soft balloon. Parents may see it all the time, or only notice it when the baby cries, strains, or laughs. Larger hernias can bulge out clearly, then slide back in with gentle pressure. Sometimes you even hear a little swoosh as the air or fluid moves inside the intestine. Growing up, I knew children whose umbilical hernias were so prominent they became nicknames like Nkechi Otubo or John Otubo. In Igbo culture, Akpu Otubo, umbilical hernia, was common enough to be an identifier. Who gets them more? Often, umbilical hernias are more common in black children than in white children. Still, the vast majority close on their own if given enough time. What I do during an exam. When I examine a child, I gently press on the hernia to see how easily it goes back in. I also feel for the opening, the ring in the abdominal wall. If parents are curious, I sometimes guide them to feel it themselves. The moment you remove your hand, the hernia pops right back out. As predictable as a jack-in-the-box. Possible complications, rare but important. In more than 30 years of practice, I've never seen a serious complication, but they can happen. So I always explain what to watch for. 1. Pain or tenderness in the hernia. 2. Redness or swelling around the belly button. 3. A hernia that becomes firm, stuck out, and cannot be pushed back in. A stuck hernia can cut off blood supply to part of the intestine. It's rare, but it needs urgent medical care. When to see a surgeon? I refer children to surgery when A. They are around 4 years old and the hernia is still large. B. The hernia hasn't improved after a couple of years. C. The hernia sits at an unusual location around the belly button. D. The child has a condition like hypothyroidism or a chromosomal disorder that makes spontaneous closure less likely. Culture, myths, and home remedies. Many parents try covering the hernia with tape, cloth, or bandages, hoping to force it closed. Unfortunately, none of these methods work. In fact, they can irritate the skin and lead to infection. The bottom line: umbilical hernias in infants are usually harmless, painless, and temporary. Most close on their own with time and patience. The key is knowing what's normal, what's not, and when to seek help. Please this podcast with friends and families.